Heroin deaths have nearly quadrupled in the U.S. during the past decade to more than 8,200 a year.
Well, now doctors are testing a potential new weapon in the fight against the growing epidemic of drug addiction. CBS News' Dr. Max Gomez is here to explain how a new tiny implant works. Dr. Max?
That's right, Allison Dick. You know, it's both heroin and prescription narcotic painkillers that have fueled addiction epidemics in communities all over the country, both rich and poor alike. The FDA is reviewing an implant that releases medicine that blocks the cravings for narcotics and could be an important addition to current treatments for drug addictions.
We were good. Yeah, we won a championship.
Drew Shaw reminisces about his glory days playing football until he was injured and prescribed Vicodin.
When I graduated, I was fully dependent on opiates, and it's a lot cheaper to buy heroin. I was sleeping on the streets of Kensington, seeing Cambria, getting heroin.
After years struggling with addiction, Shaw is off drugs now with the help of therapy and a medicated film called Suboxone. It's a dissolvable film, but he must remember to place it on his tongue 3 times a day, which means an addict who forgets or stops taking the Suboxone will develop the heroin and narcotic cravings that the drug blocks. But these tiny implants could make addiction treatment easier. Instead of taking meds several times a day, these implants last for 6 months.
It can help improve adherence to medication.
Dr. Michael Frost helped test the implants called Probafene. They contain the same active ingredient as a Suboxone film, and trials show they work as well, if not better, than the daily version.
There will be 4 of these little rods, and they will insert under the skin in the inner aspect of the arm. This helps stabilize that brain chemistry and help take away the cravings.
Shaw, who's a new dad, wasn't in the trial, but he likes the idea of the implants and not having to worry about taking the daily medications that he says saved his life.
It makes you feel normal. I mean, when you're fully dependent, it just makes you feel normal.
Now, initially, the FDA did not approve the implants, saying there wasn't enough data on how many implants were needed to maintain the right dose of medicine to kill that narcotic craving. But the company has now submitted that information, and the FDA is expected to decide on approval this coming February. And what's important is this is not the same as the Narcan, which is used for overdose, for treating overdose. That's an injection. That's a really different deal. This goes after the craving so that the addicts can kind of get past that initial difficult period for a few months.
But it would seem to be extraordinary if you could apply this to other addictions, too. It would be quite an advance.
Yeah, absolutely. For now, it's heroin and narcotic addiction.
Okay.
Thanks, Dr. Max.